Hello everybody, my name is Rebecca Carter and it's my pleasure to welcome you all to Approaches to Professional Nursing Practice. I would like to spend a few minutes talking about some of the learning outcomes for the unit. These will give you an overview about the nature of the topics for the unit and the things that you can expect to have learnt by the end of the unit. We will begin by having a deeper look at the discipline of nursing, including the roles and the functions of nurses, and the image of nurses both professionally and the media and the public image as well. The image that we and the public have of us is really important because many people have an image of nursing that is inaccurate and we need to change this whenever we can. We will also be having a look at the standards for practice for registered nurses. These were revised back in 2016 and they were previously known as the competency standards for the registered nurse, but now they're known as the standards of practice for registered nurses. We'll also be exploring the boundaries of practice for the registered nurse, enrolled nurse, assistant nurses, Aboriginal health workers and nurse practitioners. So it's one thing to note though that assistant nurses are an unregulated workforce. Again, this is important because many people are unaware of the different levels or the different responsibilities of each of these levels. Closely intertwined with these standards for practice are the legal and ethical responsibilities of our profession, and we will differentiate between these two as we investigate them in greater detail. When we look at the relationship between nursing and collaborative healthcare, we'll also be looking at the partnership model between patients and healthcare professionals as we assist patients to maintain their own health. Related to this outcome is the concept of transformative nursing practice. And as you progress throughout your degree and into professional practice, you'll reflect upon your transformation from a nursing student to a registered nurse to an expert practitioner. And you'll also reflect upon transformation in patients as a result of the healthcare that they will have received. Just before we move on from the learning outcomes, there is one important feature that I would like to draw to your attention, and that is that registered nurses have specific attributes. But these attributes are not distinct and they tend to overlap as they contribute to your developing professionalism. Here is a graphic prepared to illustrate the overlap and also highlight the link between lifelong learning, self-awareness and reflective practice, and how these contribute to your transformation both personally and professionally. This graphic is also available on the Views site under the Flyers tab. The unit outline, as the name suggests, is just an outline of the unit. It doesn't contain as much information as the learning guide. It's just a summary of the main points of the unit. One very important date that you need to be aware of is the date of the first assessment task, your critical reflection essay. The link to the news article that you need to refer to is found in the assessments folder on Views. You'll also need to find the Australian Commission for Quality and Safety in Healthcare Standard 8 document there, and the fact sheet are both within the same folder. The Nursing and Midwifery Board of Australia documents you also need to refer to are available on Views, but they're in their own folder. So the essay's due in week 4, it's on Monday of week 4, so it would be a very good idea to commence working on it as soon as possible. And we'll talk more about this assessment in the first tutorial and focus heavily on it for the next 2 weeks as well. As you will see from your reading by Derbyshire this week, there are popular images of nursing that have arisen over the years. Some of these images are positive, but some are definitely not. They can even damage our profession by providing a false but unfortunately enduring image of who nurses are and what they are doing. On an individual level, it can even damage our own perception of what we do and how we think and act, which are important because they can impact upon all the people with whom we interact, including our patients. Investigating these images will not only give us insight into how they are developed, but it will also help us to develop our analytical skills, which we will need when investigating questions from time to time. There are many images of nursing that have arisen over the years, but we'll be looking at those that have mainly arisen in the last 200 years. One of the modern issues that Derbyshire does take issue with is that of nurses only working in acute care hospitals, whereas of course there are many other places where nurses work. The downside of this image is that nursing not occurring in hospitals is in danger of not being seen as real nursing. However, it should be noted that only about 50% of nurses actually work in hospitals. The other 50% work in community settings and schools, and you will find this when you attend your clinical placements for PPE units. Derbyshire also discusses in some detail the most prominent stereotypes of nurses today. As he observed, some of these stereotypes are not only annoying, but can be pervasive, but more so damaging to the profession, particularly if people internalise them and begin to see them as reality. It is, of course, worth noting that most of these stereotypes are not realistic and in most cases not favourable to the profession. Major stereotypes that have been identified include sex kitten, angel of mercy, doctor's handmaiden, and of course the battle axe or bad nurse, and that is featured a lot in nursing movies. Although being perceived as an angel may be attractive on the surface, as Derbyshire points out, it comes with a caveat of perfection, which is something most humans are incapable of achieving, and you'll probably burn yourself out trying to do so. It also overlooks the hard work and dedication that's required to become a nurse. These images all exploit the angelic stereotype of nursing. And although it may be nice to be portrayed in this way, these posters often had another agenda. The example of the recruitment posters of the US Army were aimed at not only recruiting nurses, but by recruiting women into the forces, it would shame men who had not volunteered into enlisting in the army. At the other end of the spectrum is the battle axe or the bad nurse. You can see on this slide Sarah Gamp, a fictional character from Charles Dickens from his novel Chuzzlewit. I don't have time to go into her antics today, but she certainly was an interesting person. Another damaging image is that of sex kitten. One of our biggest problems with this image is that it's actually stopped people from becoming a nurse because they didn't want to become a sex object. There are many developing factors contributing to this image, but Derbyshire suggests that one of the most important ones is that nurses have access to intimate body parts that, generally speaking, other people don't have access to. Finally, doctor's handmaiden is another inaccurate image of nursing. It is thought to have arisen from the military origins of nursing. Indeed, if you look at nursing imperiously, you can see the strict hierarchy is actually reflective of the military. Contrary to some of the popular images, I want you to remember that nurses perform valuable and critical tasks as part of the overall delivery of care. This is another reason to change the popular image of nurses and replace them with more appropriate images. The public frequently remains unaware of the vital role performed by nurses. Nurses are professionals in their own right. They work alongside doctors and allied health professionals to deliver patient care. The discipline of nursing is not subordinate to any other health discipline. Nurses are the people who spend the most time with the patients, so we'll have a greater understanding of their requirements and their responses to interventions. With that profession comes certain accountabilities and responsibilities, and we'll be looking at some of these in the coming weeks in more detail. So what can we do to change some of these images? One of the best ways is to continue to model professional behaviour so that the general public will obtain a better idea of the role of nurses and build a more accurate image. For you, it would be beneficial to find nurses who model that behaviour that you know is required of professionals and model your behaviour on theirs. In time, you'll find others modelling their behaviour on you. If you do find any inaccurate images of nurses, please take that up with the person that portrayed the image in the first place. There has been some notable examples, particularly in America, where nursing organisations have taken television programs to task and have actually managed to get those television programs to portray a more accurate image in future series. So we can all make a difference. This would be a good time to say a little more about critical reflection. Those of you who studied professional communication last semester will already have been introduced to this concept and will know that the important part of being a professional is the ability to think carefully about what you're doing and identifying the influences on your thinking, decisions, consequent actions and outcomes. Critical thinking enables you to identify what went well, what was not so good, what needs changing, the meaning you made of an event, and the factors that influence that meaning. Because it is so important for nurses to be able to reflect, 2 assessments of this unit will include reflective pieces. Critical reflection has been integrated into the electronic portfolio because, as highlighted by Twaddle and Johnson, your nursing portfolio is the perfect place to demonstrate critical thinking skills. Again, there is nothing mysterious about reflection. It is something most of us do every day. What we need to do now, though, is to recognise that reflection and engage with it on deeper levels. Here is another flyer that Dr. Susan Alexander has prepared on the topic of critical reflection. Please download it from the View site and read it carefully. There's some important information there about critical reflection and different models that you might use. Often when people talk about reflection, they think of writing in a journal, and that is one way of reflecting, but it can also be performed through other media such as poetry, drawing or other forms of art. Critical reflection helps you to learn more about yourself, therefore about how you might be influencing other people. We're getting back to the earlier topic now, and that's the overlapping of professional attributes. Critical reflection allows you to identify the transformation that is occurring in yourself. And as you progress through your university degree, and as you become a professional practitioner, it will also help you to identify transformations in other people as well. Now it's time to move on and talk about your electronic portfolio, which is the second piece of assessment. Some of you may be wondering what a portfolio is. There's nothing mysterious about it. It's simply a collection of information about you as a professional. In the past, people kept paper copies of portfolios, but increasingly they're being established and maintained online, and that is what we will be doing for assessment. Have a look at this document that gives you an overview of professional portfolios, why they should be created, the sorts of information to include, and some hints that you can use when you prepare yours. I've included a copy of this flyer on the View site under the Views tab. Please download it and refer to it when you're commencing your electronic portfolio. One thing to remember though, a portfolio has other functions aside from being somewhere that you'll keep information about yourself as a professional and personal information too. It also helps you to increase your self-awareness, which is another professional attribute that we were speaking of earlier. Increasing self-awareness will help you to determine areas of personal strengths, opportunities for growth, and will also to assist you to identify some strategies to achieve your personal goals. And as per the learning guide, there are 4 mandatory components of the portfolio. However, you may include others. We'll talk more about your electronic portfolio in the coming weeks. So that's all that we have for this week, and I look forward to talking to you more next week. Have a nice week. Goodbye.